Good morning from Hong Kong. This is Asia Society Hong Kong Center, and we're delighted that we will be hosting an interesting program this morning, not technically part of our COVID-19 update, but it is COVID-19 related. And so I'm really excited that we have an eminent scientist he kind of is an unsung hero of this COVID-19 story. We're hearing more about Dr. Wang Nianshuang's story, Nianshuang Wang story in the last couple of months. I first heard of Dr. Wang. I'm going to call him Nianshuang because I've gotten to meet Nianshuang online 2 or 3 times. I've gotten to meet him over this last, since last week, but I've been long admirer of his work after hearing his story in the podcast, This American Life, Boulder versus Hill. It was broadcast first around December 21st, around the holiday season. And a friend sent me the link, and I just found his story fascinating, and all of the scientists in that story fascinating. The gist of the story of Boulder versus Hill was in some ways about teamwork, and how in short period of time, in 11 months, from the beginning of coronavirus, COVID-19 being declared as a pandemic, in a short time of 11 months, vaccine was on its way. And that is totally unheard of. I think it is something that is quite historical. In fact, at my first COVID-19 update on February 14, 2020 with Dr. Ben Cowling, that was one of the questions we ended with is, how long would the vaccine take? And he said it was going to at least 2 or 3 years. And at that time, in February of 2020, little did we know that Nianshuang and his team and his researchers were already hard at work to see his mRNA vaccine. And I'm going to let him tell you more about that because I am not a scientist. And so I'm going to turn it over. Nianshuang, welcome to Asia Society in Hong Kong, and who is speaking with us from New Haven, Connecticut, his new home. And Dr. Nianshuang Wang is now with Regeneron Pharmaceutical Company, but his research at the time, it started first at Dartmouth and later on at University of Texas in Austin. So Nianshuang, tell us about your research that kind of led to the vaccine that, in fact, I will be doing the Pfizer BioNTech vaccine later on this week. But tell us about your research that has led to this breakthrough.
Hello, everyone. This is Nianshuang. So I'm in New Haven now. So glad to join this program. It's a very nice experience to be here. So actually been working on coronavirus since 2013. So it has been around 8 years till now. So in the past, I started working on coronavirus actually during my PhD while I was in Nianshuang Wang's lab, and then get into Dartmouth to join Jason McLellan's lab. We continued working on MERS coronavirus. We were trying to stabilize the coronavirus spike protein, which is the major component to achieve a vaccine. So we really want to get a structure, and also we want to, based on the structure, to design mutations to make the coronavirus S protein to be stable and which can be optimal to create a new vaccine. So we spent several years. We identified 2 protein mutations, and this protein mutation can stabilize the prefilled S protein to get it more stable. We can create more to get it more immunogenicity. Which is really nice. So that technology we developed in 2016 has been now used in a lot of leading vaccines, including Moderna and Pfizer's mRNA vaccine, and Johnson & Johnson's adenovirus vaccine, and also the Novavax. They are using it to create protein subunit vaccine. So that's basically my major contribution during the past years. So yeah, glad to be here.
Well, what I found interesting is one of the stories that was interviewing, I think it was SCMP story earlier, about a few months ago, your 4-year-old daughter, I think, and who now realized you're one of the heroes, because in some way this is like nothing we've ever seen. It's a global pandemic. It's affected almost every country, well, every country in the world. And right now, with millions of deaths, and in the U.S., I think it's over 500,000 deaths. And there is a light at the end of the tunnel with the vaccine. So your contribution is really cannot be minimized, because it's been without it, which you worked on, like you mentioned, 7 or 8 years. And I think without it, in fact, even Dr. McKellen, your advisor, had said, if this coronavirus, COVID-19 had happened about 10 years ago, we would not have seen the vaccine as develop as fast as it has. So, but tell us, how did you get started? It's my understanding is you started with MERS, the Middle Eastern Respiratory Syndrome. So, and you were in China before you joined Professor McKellen. So tell us about your China journey. You're from Shandong, and how did you go from very humble beginning in Shandong? Tell us about your village, and then how did your journey from Shandong to Tsinghua to the U.S. Just kind of, I want to hear from your own story, because I find that fascinating. Is that you didn't, and in fact, how you got to Tsinghua was also quite interesting. You did not need to do the tests. You were admitted to the PhD program. So tell us about the Shandong to Tsinghua journey first.
Yeah, actually, yeah, I was born in a very small village, and actually, my family is like it's very common, actually very poor. My parents actually didn't even finish their elementary school. So yeah, I'm actually, yeah, people would like to call them to be the first generation college students. I'm maybe the first generation, even like a middle school student. Yeah. So yeah, while I was young, we don't have those much resources, and but I'm always curious about our nature. Yeah. Especially I want to know the rules, the principles behind the nature, what is governing this whole thing, and I want to know the details. Yeah, I'm always curious about that, and yeah, I actually while I was young, I would like to go to the wild to catch locusts, to catch scorpions. Yeah, do all those kind of things. I don't have much pressure, and my parents didn't give much pressure. They didn't expect me to be one day to become a scientist. That's not in their mind. But I think I'm interested. Yeah, and yeah, as I get older, get older, and I think I want to do something. Yeah, I met a lot of excellent people as I get into high school, get into college, and I think I need to join the community, to learn from each other, and to really make myself better. And yeah, I find that I have some talent in science at that time, and I think I really need to move forward. Yeah, I got it. Yeah, actually, I'm pretty good at biology, even during my high school. So when I need to choose my major to find a good college to pursue further, I think biology would be my best choice. Then I started to working on biology.
So you went from the village and just high school, and ended up at Ocean University in Ocean University is located where?
Tsinghua. Yeah, Qingdao.
Right. In Qingdao. So you ended up at Ocean University in Qingdao, and you got your undergrad in biology there. And then how did you end up in Tsinghua University? Because my understanding is also how you got there is also quite unprecedented, because of your research. You did not need to take the exam; you were admitted. I mean, so tell us about the Tsinghua journey.
Actually, there's some kind of those those pathway when you really did well in your during your undergrad, you can apply for those top universities. So I tried that, yeah, and I tried several different places, and including Tsinghua and also some other places, but I got the chance to get into Tsinghua. So yeah, that's pretty fantastic, pretty interesting journey, yeah. And I got into Tsinghua and talked with my actually finally to be my supervisor, Nianshuang Wang, and we are both excited, I think, yeah.
And then from there, how many years were you at Tsinghua?
5 years.
Okay. And then you had an opportunity because of the, did you start doing your mirrors, some of the coronavirus research while you were at Tsinghua, correct?
I didn't start with coronavirus. Actually, I started with some other projects. Initially, yeah, when I joined Tsinghua, Xinchuan think I'm pretty good at doing research, and probably I should take some more challenging work. Yeah, I actually struggled for 3.5 years on some other projects, but yeah, you know, sometimes doing research is kind of like not depends on whether you are talented or not. Sometimes you just get into some field that can be really challenging, and also I don't have much background in those fields. Yeah, so I was scoped twice. That means before I publish my work, someone already published it. So yeah.
So how did you ended up with Professor Jason McCullen? He was at Dartmouth at the time, because my understanding from at least the podcast is that you ended up going to Dartmouth to join him. How did that happen?
Let's first start with coronavirus work during my PhD. So that's in 2013. I think it's in March. Actually, at that time, MERS coronavirus has already been circulating in the Middle East for around half a year. So the first paper about its receptor was published in March 2013. So I started the journey with that publication. So we quickly work on the molecular mechanism of the MERS protein binding to its receptor, and it's pretty. At that time, I didn't expect I could achieve a structure in such a short time, but we did finish the work in less than 2 months and quickly published. That's actually my first paper, and it's very unexpected, and I'm very happy with that. Yeah, we also collaborated with Linqi Zhang's lab. Also in Tsinghua, we isolated the first MERS neutralizing antibody.
And so go ahead.
Yeah, at that time I started to feel that I really need to work on the coronavirus or in the whole infectious disease field for my future. And so I started looking around to find out some other labs that are also working on infectious disease, and could be very interesting for me to pursue my future career. So till the end of 2013, and I just got to know that people in NIH did really fantastic work on engineering the ISVF protein to create a very nice vaccine antigen, which could finally get into to become a successful ISV vaccine. Yeah, so I started to learn those work and find that it's actually Dr. Jason McCullen's idea and major contribution to develop the prefusion ISVF protein. Yeah, I think that could be the future of the future of vaccine technology.
I see.
Yeah,
Dr. Jason McKellen was at that time at Dartmouth, and he invited you to come and to work with him. So what year was that? It was 20.
When I first email Dr. McLellan, it's I think it's January or February in 2014. Yeah.
And so when did you end up at Dartmouth then with him?
I quickly had a Skype meeting with Jason, and after 1 week, he said, "Okay, yeah, I think I would like to have you to be a postdoc in my lab." Then in August, yeah, that year, I joined his lab in Dartmouth. Yeah.
So 2014, you arrived in the States and joined Jason's lab. And my understanding is, I think the kind of research you guys are doing is coronavirus related. And then how did it end up? So a lot of the grunt work, my understanding is in the times you guys are working on, it's not, again, a technology that's happened overnight. You have been hard work and your postdoc with him, and then just tell us about that journey from in terms of working in the lab. A lot of trials and error, and it wasn't always successful. And then in being, again, from the podcast, some of the things were it took a while. So tell us about that journey then.
Yeah, it's actually pretty hard to make any progress in that journey. Actually, I spent more than 2 years to identify the 2 mutations. So at first, yeah, when I first joined the lab, actually we don't have much knowledge about this protein, and the whole field don't have much knowledge about it. Yeah, because the coronavirus research is far behind some other viruses, including HIV or flu or even RSV. Yeah, until 2015, yeah, we even don't have our S protein structure. So at that time, it's just try and error, and we just try all possible ways. Yeah, the first stage is that we should borrow some ideas from other virus research, including flu HA protein or SVF protein. So we borrowed a lot of ideas. That's the first stage. For example, we can use we can get mutations into the S protein to mutate the fusion cleavage site to get it a single chain. This idea actually have been used in a lot of current COVID-19 vaccines. Yeah, that's some idea. Also, we can try to use C-terminal trimerization motif to get it into a trimer. So we know that all these class 1 fusion proteins would be a trimer. So these technologies have been developed maybe in 2003, 2004 for flu HA proteins. So we just borrow those ideas. But we find that coronavirus S protein is really challenging. Even we borrow those ideas, S protein is still very unstable. Yeah,
And also tell us, how did it, I mean, right now, one of the things that I read is in terms of the research, when you guys finally made a breakthrough, a lot of the journals, turn you down. And so, because again, because I think you alluded to it, because of the other research, a lot of money was going to it. And maybe by then, when you were doing your research, Maris was almost over. The money wasn't there. It wasn't sexy enough. And so when you were submitting it to some of the journals, I mean, I think 5 out of the 6 journals turned you guys down because, again, people thought people weren't interested in the topic anymore. So it must have been really hard trying to, because that's still your research. Your research is focusing on the coronavirus. How do you kind of balance that? Because it must have been really depressing, because what your work is doing is still needed, because you obviously saw a need that, like you said, coronavirus was happening quite often, but the focus hadn't been on there. So how do you balance that figuring out that what you guys are doing is still important, but people aren't paying attention to it. How did you balance that?
I think there's a like a yeah, I don't know how to say. Yeah, actually we have like a very high expectation on this work to be accepted by the general field, but actually it's we didn't get much recognition initially. That people don't think this could be a really like a great work for the future pandemic. Yeah. That's actually my only project in the lab at that time. So I expected too much probably, but I do think, and the whole lab do think that it would be a fantastic technology for future pandemic. Actually, it's, in the past like 20 years, SARS broke out and then MERS broke out, and they all caused pretty severe problem to our health system. And we should expect that the future pandemic could happen someday, maybe not in 1 or 2 years, but in future, it could be another pandemic. Yeah, we expected that, but when we submit the paper, people didn't say, yeah, they mostly focusing on on some other aspect, because we also determined the most coronavirus S protein structure. They focusing on that, not focusing on technology to generate this protein. So I was actually pretty depressed at that time.
And tell us about your depression. My understanding, you also saw help. I mean, it's not unusual because as a scientist, this is what you do, and people didn't recognize the work. And my reading of it in research, it also, we hear about the Hungarian biochemist, Professor Catalin Carrico. Also, her work was done in the 90s, also in similar, more on the mRNA technology. And her work was not recognized by her University of Pennsylvania. And now she's with BioNTech, but 1990s until now, also a struggle. So how do you kind of, as a scientist, I think right now we're always chasing the fad. And I know, in the 90s, again, the HIV, or there was a lot of other research getting funding. And obviously your field was not at the time, but without the work of all the grunt work that you and others put in, we would not have gotten the vaccine as fast as we have. So, but when you were depressed, did you, I mean, obviously you didn't think about it, but how did you address that depression to get yourself out of it? Because we're all going through this right now. We all think it's this never ending. People don't, how do you address your own kind of struggles there? And you obviously got out of it, thank goodness, because or else we would not be seeing the vaccine. But how do you deal with your struggles at the time?
The first thing is that you have to believe your work actually is really valuable. And I do believe that at that time, even got rejected so many times. And then I started to realize that people actually started to use this technology. Yeah, probably in early 2018, that people have started to use the two protein mutations we created for their research, and they actually published pretty nice paper. Yeah, one of those published in Cell, so that's a pretty nice journal, even better than what we published. Yeah, I started to feel better that good research doesn't have to be published in a very nice journal. Yeah, the good way to recognize your work is that people are actually using your invention, using your previous research for their research. Yeah, that's making me feel better. So I think people are using my research. People started to know that it's a great technology. Yeah, that's what I want. I think what I want is not a good a very popular journal, but people have actually been using it.
So
yeah, I
you're
started feeling better. Yeah.
great. So
And
you recognize your
yeah.
work is being used by other scientists.
Yeah, and also there are some other very nice review papers. They started to summarize the key technologies in the previous vaccine technologies, and they started to recognize our contribution. They say this is a great technology in the field of structure-based vaccine design. This actually, yeah, this is actually the first trial, first successful example for structure-based design to be in the coronavirus vaccine design. So.
Then I think let's talk about how it kind of Jason got the call from NIH, and in January of last year, in terms of NIH was ready to give it a try, the new technology, right? Because and even the lab that was set up by at NIH for the research, in fact, Dr. Barney Graham was mentioned quite prominently. He's in charge of the research lab. They, bet on this, right, in January and called Jason up. And then my understanding, within days of getting the call from NIH, the Chinese scientists had released the genome sequencing. And I think, and you guys jumped on it right away. So you talk about, and you were able to decode it or whatever, build on it within hours, because you already seem to have the keys to the basic research. So talk about that, because the NIH, it's almost like the timing was right. All the work you guys have been doing, NIH realized that, hey, let's take a gamble on this, or calculated risk, because it's not like Jason's lab was, it has been there. And by then Jason's lab has moved from Dartmouth to University of Texas at Austin. So that, to me, you guys must have been excited. I mean, tell us about the call in January, because again, January, we were just hearing about Wuhan, and they were already having an idea, hey, this might be something big, that we might need your help. Your research is going to come in really handy now. So how fast from, that, when Jason got the call, you guys were in the lab, how fast did you guys work on that to the next thing was, Moderna comes into the picture. So tell me about that process.
Yeah, actually I have been like looking into this virus since the first day that in Wuhan they said there's a like unknown, probably unknown, that's infectious disease in Wuhan that has been causing troubles there. I started to realize that it could be something that we can work on. Yeah. At that time, I'm not sure whether it could be a coronavirus or not, but as it moved forward, more information was released, and we started to know that it's actually a coronavirus. We think that that's something that we have been working on for the past years, and we also hope that our technology in the past could do some contribution in this field. Yeah, and then it was only until January 10th or 11th that Chinese researcher started released the sequence that we can actually really move on. I think all the current vaccines started from that the release of that sequence. I think that's a big contribution to the whole world to release the sequence, especially we know that's the S protein sequence. That's the key for all current vaccines. And I found the sequence, and another PhD student, Daniel Rapp, and Jason, we started to circulate information about that to discuss about the possibility of design the protein mutations in it, and also we share information with the NIH to really quickly move this forward. Actually, the coronavirus S protein are all really similar, especially for the SARS-CoV-2. We know that after we obtain the sequence, we analyzed it, it's actually 80% sequence identity to the SARS-1 coronavirus. We realized that our technology should work and should be able to really stabilize this S protein. So we actually didn't take much longer for us to create the 2P mutations in the SARS-2 S protein. It's maybe only take 5 minutes, I think, as long
really?
as yeah, as long as you get the information about where to put the 2 mutations, because it's basically a sequence alignment and directly introduce the 2 protein mutations. So that's pretty quick. Yeah, we share all this information. We have been communicating with NIH. So it's a pretty fast process at that time.
And then when did Moderna comes in? You guys have licensed that, or the patent is Jason's iPad. How fast did it move from when you finished doing the work with the sequencing? How did and because Moderna, my understanding, was one of the first that you guys work with to put this technology to work.
Actually, Moderna didn't start working on coronavirus vaccine like in January last year. They started actually in 2017 for the MERS coronavirus. They already know that the 2 protein mutations could be really great for creating a coronavirus vaccine. They have been working on MERS coronavirus vaccine for a while. At that time, they already put the 2 mutations in. Yeah, they have some previous animal data, like mouse data, and to introduce 2 protein can get a better immunogenicity for MERS vaccine. So it didn't take much longer for them to collaborate with NIH to put the 2 proteins in. Yeah, it's all built on there, like 3 or 4 years previous MERS coronavirus vaccine work. Yeah.
So it sounds like a lot of the work with the coronavirus, what happened in SARS here in Hong Kong, 2003, MERS, and all the research and technology, you kind of build on each other. And it sounds like what you said earlier too about your, other scientists using your work and building on that. So it is almost kind of a step. It didn't just happen. I think sometimes for those of us laymen, not understanding, but it is kind of like a step process. One understanding building on the other, and then and hence we can have the vaccine for this COVID-19 so quickly. So it one step
Yes.
at a time. But the grunt work that you built in the the 9 years that people, or 8 years people do not know about, is something that I think we're very grateful for. So then I wanted to talk about a little bit about teamwork. I mean, that's another thing that I took away from the podcast, is how much the teamwork. I mean, you're the lab that Jason had, and the others involved with it. Even though you're not there anymore at University of Texas Austin, the teamwork element, and you also kind of talked about it also in Tsinghua. Along the way, you work with people, but you yourself has been kind of driven. Your curiosity. So it sounds like your curiosity from when you were a kid to your curiosity still has it, is kind of taking you forward. So talk about some of the mentor and the teamwork that you have worked with, from whether in China or the U.S. How has that kind of shaped your work?
Yeah, teamwork has always been important, actually. For example, actually, for our 2P mutations, actually, we can't make the 2P mutations without the structural study. Actually, we collaborated. We have always been collaborating with NIH, with Fanny Graham Lab, and also we have been collaborating with Andrew Ward Lab in Scripps. Without those collaboration, we can't figure out how to put the 2P mutation. Yeah, we throughout the past 8 years, I think we have always been collaborating, and of course we can't achieve any of these results without standing on the shoulder of big giants. So yeah, a lot of early fundamentary theory and experience has already been built before we start our coronavirus work, including the Jason McLellan and Barney Graham's previous work on ISV. Yeah, we borrow a lot of ideas, and also we would like to share our ideas with a lot of other people, and also especially for my postdoc in Jason McLellan's lab, we have always been collaborating, even inside the lab. Yeah, for the coronavirus structural study, actually we reported the first coronavirus SARS-CoV-2 S protein structure only 1 month after the sequence was released. That's a fantastic work with very fast speed. We really collaborate. I worked together with very nicely with Daniel Rapp, another grad student. He's very talented. So yeah, I think that helped me a lot. Yeah, in the lab, we learn from each other. We keep communicating, how we share our ideas. Yeah.
Well, now I want to touch upon a subject which I know, as a Chinese American, I was, we were all shocked and surprised at, some of the terms. That was the China virus, the Kung Fu virus, all of that. And you, as a Chinese scientist, working in the United States during this time, I mean, must have been difficult to hear all of that from the White House, and now we're seeing a lot of anti-Asian violence in the United States, and talking about the collaboration without the work you've done and others also in China as well. I mean, how did you feel when you hear about what President Trump at the time was calling? And then the suspect, my understanding is you and your wife were also advised to get a lawyer, and because they were accusing Chinese scientists of stealing, technology, but you have been working on it for 7 years. So how do you feel in that time, in the course of it? I mean, it's been a really intense year for you. So how did that make you feel?
First, I think to call the virus to be China virus, to be Kung Fu virus, doesn't make any sense. And it's not only anti-science, it's also anti-common sense. It just makes no sense, I think. And no one has showed any evidence that China actually created the virus or directly released the virus. Actually, there's no evidence about that. Yeah, it's definitely some political reason there. So I think that's not good for the whole scientific field. Yeah, we should avoid to avoid putting those political issue into science. It will cause a lot of damage.
And
as a Chinese, I think, we all work together on the whole vaccine effort, on the whole antibody effort, drug effort. Yeah, actually all these vaccine has been contributed by a lot of scientists. They are from all over the world. I think we have a really nice scientific community here that work together on it. They are from different countries. They all kinds of different people have contributed to even to this to our vaccine effort. Yeah. Also, it's a collaboration of different universities, hospitals, also the government. Yeah, a lot of different people from there. I think we enjoy this global collaboration. Yeah.
That's one thing I have to say, because we've been doing this coronavirus update since February last year. And what has really struck me is really the globalness of this pandemic, but also the globalness of the collaboration. And that is vital. And it doesn't help when the political backdrop started accusing one or the other, but the collaboration sounds like something that it's as a scientist, how do you wish now we have a new administration, they're talking about kind of a restart. My concern, I think education has been one of the most equalized. That's why your story is so fascinating, in that you go from a humble beginning in Shandong, and to be able to reach this pinnacle of success, not just your own success, but the success of helping to get the virus to the global. And your parents must be really proud of you and your village. But so this to me is a kind of this really rags to riches, not in terms of wealth, but in terms of contribution to humanity. And the collaboration is the key part of this. But how do you feel in terms of the future? Are you positive? What would you like to see in terms of, if you can advise, the leadership of either, what would you like to see in terms of educational? Because my concern is sometimes there has been many universities are concerned that postdoc like yourself cannot come. I mean, I was wondering if you were working with Professor McKellen at the time of Trump administration, where they have given you the visa. You arrived during the Obama administration. So what is your concern now for other postdocs like yourself from China who would like to collaborate, come to the United States? Are you, your feelings about that?
I think, yeah, a lot, yeah, a lot actually from even my friends in China, there are several of them that actually they are working on coronavirus, but they cannot get a visa to get into US now. So that's really like a disappointing now. Yeah, since past year, and people find it really hard to obtain a visa to actually get into US. Actually, they have previous background working on coronavirus, but they cannot get in. I think that's definitely an issue now. So really, that's not a good thing for the global fight against this coronavirus. I think currently for people travel out, for people holding a working visa for H-1B or J-1 visa, if we travel out of US, they probably will not be able to get in again. So yeah, I think this policy is really not good. Yeah, I hope the new administration can really put some effort on it, at least to make it easier for people to travel, and even they are not only come to learn, they also come to contribute in the scientific field, and even people, only if people can work together to unite, to work on this, to deal with this pandemic, that we can achieve a better result in future.
I see. We have some questions from the audience here, and I'm going to ask some of them because I don't think I'm going to get to most of it. One of the questions from the audience is, could the spike protein give out general mutation effect to all variants?
The spike protein, sorry.
Give out a general mutation effect to all variants.
I think the two mutations I generated is actually it's pretty universal. I mean, it can be used to fight against SARS coronavirus and SARS-2 coronavirus and also MERS coronavirus. They have been tested on a large variety of different coronaviruses, and it's all okay. It's a universal strategy. And but as to the new variant that came out, like the South Africa strain and the Brazil strain, so those I think generally we need to update our current vaccine. Actually, I think Moderna and Pfizer has already started those work. Yeah, that's because the spike protein can mutate, and once it gets mutations, it could be possible that this new variant can escape from current vaccine. The thing is that we need to generate new vaccines specifically designed for those viruses. I believe that those vaccines will also including the two protein mutations in it, but we do need to update those vaccines.
I see. So do you see us kind of getting the vaccine shots like we do flu shots every year? Is that something that we have to do every year to get the booster?
It's quite uncertain even till now, yeah, but it's likely possible. And we will do the vaccine update like pretty often, I think, whether it's every 1 year or every 2 year or something like that. We are still uncertain.
One of the questions from the audience asked, did you encounter any racial discrimination while you're working in the state, especially after the virus breakout? Have you personally encountered anything?
Basically, I haven't encountered much. Yeah, I think basically in the scientific field itself, it's pretty okay, and people are pretty friendly to each other. And also in our university, even in my current company, people are from all over the world. Yeah, people can can be very friendly here. Yeah, but different people have different cultures or different character, different style. Yeah, for those things, I think we all respect those kind of different a variety of people. That I think that's good. Yeah.
And you're one of the things I am curious, you when we had the conversation before, I'm really interested in your personal story in terms of your village. I think you said the village now know who you are. They're very proud of you. And in fact, your story also reminds me in the podcast, Kismetkia Corbett, who's a viral immunologist at NIH. She mentioned that her parents have no idea really what's she has done in terms of the contribution, and your parents probably the same, not knowing the kind of work because they were still in Shandong. So how have they felt about your success? Do they know what has been happening in to your career?
They actually don't know, of course. Yeah, I think that's common for even for people that's with higher degrees, they probably still can't understand what I have been doing. Yeah, I think that's common, but they all know that I have made a pretty good contribution to the current vaccine. And they have already been very proud of me, but now they feel, yeah, I'm really good now. So I
That
think
that
that's
must be.
good. Yeah.
But I'm sure you mentioned before when we had this conversation, you haven't seen them in 5 years.
Yeah.
And you since then have a member of the family they also have not seen. You have a daughter who's 4. Then they also have been able to meet her in person, and I'm sure it has to be via Skype or that your granddaughter get to meet the grandparents. But that must be a difficult. And also another question I asked you about, because many of us here in Hong Kong, thanks to the vaccine that has arrived, are already beginning to get the shots, and I'm hoping to get it this week. And you yourself you're not on the list. You help make it happen, but you said you're not getting it. You don't know when you're getting it. So when do you think you will get it?
I'm not sure actually. I think I'm healthy, I'm young, and I have no previous disease or something. Yeah, I think I would like to give this opportunity to those people that really need it now. So I'm okay. Yeah, if I can't get it soon, but I think generally in US, I think the idea is that uh, to this May, the vaccine will be available for everyone to take. I think that's a general expectation. Uh, yeah, I will definitely get the vaccine. Yeah, when it's freely available. So
So what are you looking forward to? You've made some changes in your career. You're now in with a private company, Regeneron, and you now have a 4-year-old daughter. You and your wife are living in New Haven. What is your expectation for your daughter? I mean, what your prescription of how you grew up in Shandong is very the curiosity, but your parents kind of letting you explore, and in some ways because of their education level, that they couldn't supervise you. In some ways you grew on your own. What is your expectation of your daughter who's growing up in the United States? She already knows you're a hero, and but kind of talk about some of the you and your wife's expectation of um, education. I think in some ways, what kind of education would you like to have for your own child?
I hope that she would freely choose her future. I think that's my expectation. I don't expect her to be another scientist or something, but I want her to be more independently choose what she wants to do. Actually, for me, while I was young, I actually don't know how much choices I have, but I want my daughter to know that she has a lot of possibilities and she can freely choose her future. When I was young, actually, we don't have those resources. We even don't have a library. And yeah, actually, we yeah, my elementary school is actually pretty bad. I think. Yeah, we just got the electricity when I get into elementary school. Yeah, we don't have those many books or even some other material, those toys. We don't have that. Yeah, but for my daughter, I want to let her know that she has a lot of different possibilities. Yeah, I will respect her own decision, and I will try to get all kinds of resources to her when she really need. I think that's key. Yeah,
That
and
is.
yeah, she will get her 5-year-old birthday. So I got her a microscope, very little one. So
First science
I,
lab, yes.
yeah, it seems she liked it a lot. Yeah.
So
So
you are
yeah,
helping her to guide her with the microscope. That is great.
I
Because
actually asked her whether she wanted. She said yeah, and I bought it. She was very excited, and
Well, but I think 5-year, I mean, they are so exposed. One of the again, I was really touched when you said your daughter, she knows enough about, I'm sure, because she can't go to school, right? She is wearing masks. But she's growing up in this really interesting time, isn't she? I mean, this last year, I have a 7-year-old niece, and she just went back to school this week, and these kids are growing up in this really unique time for her to recognize that her father and that microscope was part of your education, and she's interested. And also as a girl, girl power, girl scientists, go for it. I'm so happy to hear that please wish her a happy birthday. I think she's going to have a wonderful 5th birthday celebrating with her parents. And your wife, I understand, is also pursuing a graduate degree, getting her MBA and at Yale. And that's why both you guys are moving to New Haven. So I wish you a lot of success. I'm just so proud of you, even though I don't know you personally, but after hearing that story, and one of the things I want to stress, it is really a teamwork. In fact, hearing that podcast, besides interviewing you, I also am very, very interested in talking to Kismekia Corbett, who is, I believe, African-American. Also, her family have no idea what she does, but she is a viral immunologist at NIH. And it's people like you all who are making things easier for us this next couple of months when we get our shots, get our vaccine, and I think one of the reason I wanted to do this program is to really also remind young people out there that success is not overnight. Right now we have a lot of interns. We work with a lot of young people. And I think many of them are expecting perfection, and maybe sometimes parents also add to the pressure of perfection. Whereas I think your story of just being curious out in the countryside of Shandong, we're in your village, and you're only 34, right? So I think your future is bright, and and as a Chinese American, I'm sure your family is proud of you, your village is proud of you, Tsinghua is proud of you, as well as your fellow scientists, in terms of the work you've done. So I wanted to thank you for joining us this morning and evening your time, and wish you all the success. And I know I hope to have you back in future program to talk about your future work. I really, I think it's something that that we will keep an eye on. But good luck with your research and with your life, and keep on, being curious, because it can only benefit mankind. But do you have any last word that you would like to share with us before we say bye?
Yes. Thanks a lot for this opportunity for me to share my story and to share my view in science, in COVID-19, also in vaccines. Yeah, I think for now, for people, I think at this very special time, I think we should all trust science, trust our vaccines. They are not made in 1 year. They are made throughout the past 10 years, 20 years. Yeah, we have all our vaccine has been built on that. Believe in our vaccine, and only in this way we can achieve a better future. And we all need to try our best to contribute on this fight against COVID-19. So hopefully we'll get back in normal in a in the next a short time. So yeah, thanks everyone. Yeah.
Thank you, Nianshuang. Thank you so much for sharing your time with us. And we're coming to the end. And before we say goodbye, I just wanted to let the audience know online that on March 18th, this coming March 18th, 5 to 6 p.m., we're going to be 5 to 6 p.m. Hong Kong time, where our next program is going to be on vaccine rollout. And we're really excited to have Dr. Ashish Jha returning to the program. He's now the Dean of Brown University School of Public Health, and also our own, Hong Kong's own Dr. Sophia Chan who is the Secretary of Health, Secretary of Food and Health, and talking about Hong Kong's effort in the vaccine rollout, and also Dr. James Curran, Professor of Epidemiology at Emory University, who has over 25 years of experience at CDC, and to share with us their, what's going on in the United States and also here in Hong Kong in terms of vaccine rollout. And again, I want to echo what Nianshuang has said about vaccine. I know some people are really nervous about it because of the new technology involved, but like Nianshuang said, the technology was not built overnight. It's been decades of research and effort by scientists dedicating their life to this. And a lot of time we do not know about it because we often don't know about it if the world is going well. But during this time of crisis, I think the work of these unsung heroes, I think, needs to be recognized, as well as the frontline workers and the doctors and researchers. So I think on that note, I want to thank all of you for joining us this morning, and wish Nianshuang all the best, and look forward to seeing you our future COVID-19 programs. It's not going away anytime soon, but we need to learn about the vaccines, and it's best to sometimes directly from the source, the scientists themselves, and ask questions. I thank those of you who have sent in the questions, and I look forward to welcoming you back at future COVID-19 updates. Thank you, and thank you, Nianshuang, and good day.
Yeah, thank you.